Dr. Peter Martin from the Lymphoma program at Weill Cornell Medical College. Welcome to our review of emerging data for lymphoma patients, or REDLAMP program. Today I'll be talking about the paper entitled Circulating Tumor DNA and CT Monitoring in Patients with Untreated Diffuse Large B-cell Lymphoma, a correlative biomarker study by authors Mark Reshevsky and colleagues from the National Cancer Institute. The paper is published in this month's edition of Lancet Oncology.
Wouldn't it be great if we could use a blood test rather than a CAT scan or a PET scan to determine if our treatment is working or to look for evidence of lymphoma coming back? The researchers in this study used highly sensitive next-generation sequencing technology to look for evidence of tumor DNA circulating in the blood of patients with diffuse large B-cell lymphoma treated in clinical trials at the National Cancer Institute. When testing the blood of patients actively receiving therapy, the investigators found that a positive test accurately predicted treatment failure only about 60% of the time, while a negative test predicted true cure almost 80% of the time. In the post-treatment setting, however, those numbers changed for the better. A positive test predicted treatment failure close to 90% of the time, while tumor recurrence in the presence of ongoing negative testing was extremely rare. Investigators also found that the test became positive an average of 3.5 months before clinical evidence of progression. Based on these data, the authors concluded that interim circulating tumor DNA is a promising biomarker to identify patients at high risk of treatment failure. More importantly, they concluded that surveillance circulating tumor DNA identifies patients at risk of recurrence before clinical evidence of disease in most patients and results in a reduced disease burden at relapse. Among the many potential benefits of next-generation sequencing technology is its use as a screening test to predict treatment failure in patients with cancer. Over 40 years ago, Drs. Wison and Junger partnered with the World Health Organization to come up with a list of criteria critical to the success of a screening program. Looking at this list today, the one that stands out here is the idea that there should be a treatment for the condition. While there are treatments that can be effective for patients with relapsed or refractory diffuse large B-cell lymphoma, there's very little evidence that using them earlier might make them more effective. In fact, although CAT scans or PET scans might detect tumor recurrence earlier than it might become clinically evident, surveillance imaging is discouraged based on the lack of evidence that improves outcomes. So Reshevsky and colleagues have clearly shown us that next-generation sequencing technology may hold advantages over existing methods of surveillance, but we still need to wait for the results of ongoing and future clinical trials to tell us where this technology is most likely to be beneficial. Here are the links to the references that I've cited, and for more information, check out cornelllymphoma.com.